We also have breaking news about how the virus is spreading. Chief Medical Correspondent Dr. Jon LaPook is with us. Dr. LaPook, what have you learned?
I just got off the phone with Dr. Anthony Fauci 20 minutes ago. He's the head of infectious diseases for the NIH. He told me there is now clear evidence that a woman who came from China, from Shanghai to Germany, and had no symptoms at the time, transmitted this virus. 4 people ended up getting infected. She didn't get sick until she was on the plane back to China. Now, the good thing is that they had very mild symptoms. And this would never have been picked up, he said, had there not been this scare.
But it sounds like bad news in that how can you contain a virus that is spreading without you seeing it spread?
Yeah. All right, so I asked Tony to give me this perspective. He said generally epidemics and infections like the outbreaks are not driven by these asymptomatic infections. And you can look at it 2 different ways. One, as you absolutely correctly say, it makes it harder to figure out who to follow, how long to follow them for. On the other hand, we're hearing about a mortality rate of about 2 to 3%. If it turns out that 10 times that or more are getting infected and it's very mild, we never know about it, then the mortality rate may be 0.2 or 0.1, which is kind of like, as he said, it's kind of like a bad flu season.
So, John, what's the significance of the World Health Organization declaring this a global health emergency?
You know, I was on that call yesterday, too, and what he said was, look, the main thing we're after is countries that do not have robust healthcare systems. You know, in the United States, we have it, and there are a lot of lessons we've learned from the Ebola crisis. There were some missteps there. They learned their lessons, and right now we're doing basic infectious disease measures, which means finding somebody who's infected, isolating them, figuring out who their contacts were, and then following them. Remember, right now, there's no vaccine in the near future, and there's no medication that works, although they're trying AIDS medications and some other drugs.
All right, I hope they don't have to use that tent out there in California. Dr. Jon LaPook, thank you very much. We appreciate it.